What is shaken baby syndrome? Shaken baby syndrome is a type of inflicted traumatic brain injury that happens when a baby is violently shaken. A baby has weak neck muscles and a large, heavy head. Shaking makes the fragile brain bounce back and forth inside the skull and causes bruising, swelling, and bleeding, which can lead to permanent, severe brain damage or death. The characteristic injuries of shaken baby syndrome are bleeding in the brain and retina, damage to the spinal and bones. The injuries may not be immediately noticeable. Shaken baby injuries usually occur in children younger than 2, but could be seen in children up to the age of 5.
Causes. In most cases, an angry parent or caregiver shakes the baby to punish or quiet the child. Such shaking usually takes place when an infant is crying inconsolably and the frustrated caregiver loses control. Many times, the caregiver did not intend to harm the baby. Still, it is a form of child abuse. Injuries are most likely to happen when the baby is shaken and the baby's head hits something. Even hitting a soft object, such as a mattress or pillow, may be enough to injure newborns and small infants. Children's brains are softer, their neck muscles and ligaments are weak, and their heads are large and heavy in proportion to their bodies. The result is a type of whiplash, similar to what occurs in some auto accidents. Shaken baby syndrome does not result from gentle bouncing, playful swinging, or tossing the child in the air, or jogging with the child. It also is very unlikely to occur from accidents such as falling off chairs or downstairs, or accidentally being dropped from a caregiver's arms. Short falls may cause other types of head injuries, although these are often minor. Call 911, first aid. Call 911 or your local emergency number. Immediate emergency treatment is necessary. If the child stops breathing before emergency help arrives, begin CPR. If you don't think there is a spinal injury, turn the child's head to one side to prevent the baby from choking and breathing in vomit to the lungs. Aspiration. If you do think there is an injury, carefully roll the child's whole body to one side at the same time while protecting the neck to prevent choking and aspiration.
Many incidents of shaken baby syndrome are not out of fear. It is important to seek immediate and early medical attention. Serious complications and death can be avoided. Here are some symptoms of shaken baby syndrome. Head turned to one side, unable to lift or turn head, blood pooling in eyes, pupils unresponsive to light, bulging or spongy forehead, no smiling or vocalization, poor sucking or swallowing, difficulty breathing, seizures or spasms, swollen head which may appear later, vomiting for no reason, pale or bluish skin, poor feeding or eating, and failure to thrive, irritability and coma. If you see any of these symptoms in your baby, seek medical attention as soon as possible.
Call your health care provider if a child has any of the mentioned symptoms, regardless of how severe they are. Also call if you think the child has SBS. If you think the child is in immediate danger via abuse or neglect, you should call 911. If you suspect that the child is being abused, report it immediately. Most states have a child abuse hotline. You may also use the Child Help National Child Abuse Hotline, 1-800-4-A-CHILD.
Prevention. Never shake a baby or child in play or in anger. Do not hold your baby during an argument. If you find yourself becoming annoyed or angry with your baby, put him in the crib and leave the room. Try to calm down. Call someone for support. Call a friend or relative to come and stay with the child if you feel out of control. Contact a local crisis hotline or child abuse hotline for help and guidance. Seek the help of a counselor and attend parenting classes. Do not ignore the signs if you suspect child abuse in your home or in the home of someone you know.
How to soothe a crying baby. First, meet the basic needs. Feed the baby. Burp the baby. Change the diaper. Make sure clothing is not too tight. Make sure the baby is not too cold or too hot. Next, try these techniques. Take a baby for a walk outside in the stroller, or for a ride in the car seat. Hold the baby against your chest and massage gently. Rock, walk, or dance. Be patient. Take a deep breath and count to 10. If all else fails, if you suspect the baby is ill, call a doctor. Together we can stop shaken baby syndrome. Now we're going to show you 2 videos, one of a shaken baby syndrome victim and a prevention video.
Yep.